class I would like to take the topic on under 5 clinic. It is from child health nursing for third year B.Sc nursing, second year GNM and M.sc nursing speciality. And this is a repeatedly asked question. As previous classes I have discussed about trends in pediatric nursing and preventive pediatric nursing. Among preventive pediatric nursing, one of the strategy what government is doing to prevent all health illness or disease in children, one of the aspect is under 5 clinic. So under 5 clinic, the main strategy or the main aim of under 5 clinic is to promote, so already you know that to promote health, then prevent disease, then restore health, and immediate care or emergency care. So this is the main aims of under 5 clinic. So the word itself is saying this clinic is not meant for adults, it is completely meant for the children below 5 years. Why they have mostly focused on under 5 years? Most of the conditions, either communicable diseases or nutritional disorders, this is all very common below 5 years of children due to lack of immunity or lack of awareness or lack of understanding about the child growth. There is a lot of illnesses occur below 5 years. That's why the government has given a special strategy for children below 5 years. That's called it as a under 5 clinic. And in this clinic, they use one symbol, that is triangular symbol. The main aspects of under 5 clinic is it is shown in this image, triangular shape, and this triangular shape is again in the middle, inverted triangle shape is there. So the first triangle shape, the first element is care in illness, because in children, especially below 5 years of children, usually they used to get a very important disease condition, diarrhea. And nowadays cholera we are not seeing much, but diarrhea is very common. And apart from that, you can see upper respiratory tract infections, or commonly the child may have some minor disorders like abdominal pain, cough, vomitings. So such kind of problems will be there. So all kinds of illnesses can be treated under 5 clinic. So even malnutrition. So if there is a mild malnutrition, it can be treated at home also. So that is called care in illness. Any kind of emergency treatment or early detection, referral services, if they can able to do the care at their level, at village level, then they can do it. Or else if the case is very severe, then referral services to the hospital. This is all comes under care in illness. And second very important task is growth monitoring, because in adult nursing we are not going to discuss those topic, growth monitoring, because it is no more special growth after adolescent period. It is according to the secondary sexual characteristics of growth will be attained. But here, especially below 5 years of children, the growth is very important strategy to identify the illnesses or sickness, because especially they have given some strategies like first 1 year after every month we need to go for health checkups. Then at second year, every 2 months we can go, and from third to fifth year we can go once in 3 months also. So that means in the first 5 years of life, growth monitoring plays a major role to identify any risk or any complications or any problems like malnutrition or worm infestations or any congenital disorders which are in a mild stage but child is showing certain symptoms. All these things can be possible when you monitor growth. And this growth monitoring, it will be maintained by growth chart. That is another separate topic I will discuss later. This growth monitoring is maintained by growth chart. It consists of height and weight. And with this we can able to identify whether the child is in a normal nutrition, undernutrition or overnutrition. That is a second concept. And the third one is preventive care. Third one is preventive care. Yeah. So, preventive care. Already in preventive pediatrics, I discussed so many things the government is doing to prevent problems in children below 5 years, especially like immunization. It is all completely preventive because we are not suffering with the disease. Just as preventive measure, we are taking vaccines. So that's why for below 5 years children, so many types of vaccines are there. That topic I discussed later. So preventive care comes under immunization, nutritional programs, then mother and child, so many national health programs like RCH program. It is giving a lot of care starting from the birth. So this is all comes under preventive care. So if you want to study about preventive care in detail, you look for the preventive pediatrics topic. I discussed so many things. Government is doing a lot of measures like immunization, national nutrition programs, ICDS program, Anganwadi program, midday meal program, RCH program, and universal immunization program. Then national advantages of these things is we can able to identify the conditions as early as possible. And continuation of this only, there are three elements I said, no, care in illness, growth monitoring, and preventive care. And middle concept is family planning. You can ask me why, madam, family planning is coming in care of under 5 children. Means if mothers are maintaining the gap of temporary family planning methods or permanent family planning methods, they can able to give a best health care facilities and best care to the born children, so that they can able to give a healthy life to the child. That is what the main concept of family planning. So I hope I gave you valuable information to you. If you really like my class, please do subscribe. And for writing 5 marks question, this content is enough, but you need to elaborate more. And for getting highest score, you need to refer standard textbooks. Thank you for watching. Please do subscribe.